are very common. Hernias are really formed when there's a weakness in certain points in the tummy wall, and things behind it can really push through. So that sometimes can be a little bit of fatty tissue, or sometimes, if they're a bit larger, it can be a bit of bowel, which can stick through. Hernias themselves tend to form in certain positions around the body. They're very common at the groin, and those two types of hernia are called inguinal and femoral. They're also very common at your belly button, and they're called umbilical hernias. Sometimes if you had an operation where the tummy wall's meant to be healing strongly, it doesn't heal quite that well. And so all wounds where you've had an operation before, there's a small risk you can get a recurrence of weakness at that point, and over time that can result in a hernia as well. And they're called incisional hernias. And so the principle is really the same for all. It's a point of weakness in the tummy wall where the contents behind then can push out and form a swelling and discomfort from that swelling as well. Hernias are very common, and in most people, they're probably quite low risk. The risk varies. Some hernias will carry more risk than others. In a sense, there'd be some hernias which, if they get stuck and come out and start causing pain, there's a risk that the contents in them, which can be either fatty tissue or bowel contents, can have its blood supply compromised, which can cause something called strangulation. If strangulation happens, that bit of bowel is then threatened. Now, certain hernias that can happen more commonly with, and one which will cause that, is the one in the groin called a femoral hernia, where we do tend to recommend repair for that. Other types, it will vary. And so some hernias will have a very low risk of strangulation. Some hernias, if there's been a large incision and the hernia is very big, again, sometimes they pop back inside very easily, and the risk of them getting caught is quite small. So it does vary, and having them fully assessed and really taking into account that risk really plays part in the decision to whether we should operate and what's the best thing to treat these. So the most common symptom with a hernia is someone will notice a swelling or a lump, and effectively, if you cough or lift something heavily, that lump tends to swell up and gets a bit bigger. In some people, those can be very small. In other people, with time, they may get quite a bit larger. They may notice the lump that as they're walking around gets bigger as the day goes on. And typically, if laying down and pushing gently on the hernia, it will get smaller, or what we call reduce. Occasionally, these hernias can get more painful, and some people may find that hernias can be very painful. Other people will find that they don't cause much discomfort, but are quite disfiguring and getting larger and causing discomfort that way. Hernias themselves, if they start becoming really painful, or they change over a short period of time, or are causing more symptoms, are ones which need to be looked at. And occasionally it can become an emergency if they become really painful or start becoming red and stuck and causing major pain. Then occasionally people may have to go to the emergency department to have them seen to, and even have an emergency operation. So there's quite a variation in the presentation as to how hernias will show themselves. The main thing for hernias is people will start to notice that they've got a swelling, they've got a lump, and then wonder what is this lump? Is it something they need to worry about? As I say, they do tend to occur in typical places, and by far the most common will be the ones in the groin. People will notice the swelling in the groin, which tend to come and go as the day goes on. If they lay down, it will tend to disappear, or they may find when they wake up there's nothing there, but as soon as they get up, the swelling starts appearing. Sometimes they're more commonly at belly buttons, and sometimes after an operation where there's a weakness from there. Hernias can really happen at any age. There'll be some very young children and infants who have them, or maybe you're in your 80s or 90s and suddenly a weakness will develop and a hernia appear. But the most common feature is a lump that slowly increases and tends to reduce when laying down. Hernia surgery is typically performed if hernias are causing symptoms and pain or discomfort, or enlarging in size and starting to affect day-to-day living. The thing to say about a hernia is it will never go away. It will never disappear on its own accord. Some hernias may not change over the course of many years, but most with time will slowly get larger. So with hernias, there are some types we would typically always recommend surgery for, specifically femoral hernias, which are at a very high risk of getting caught or strangulating or maybe needing emergency surgery. There may be other hernias as well, which may be causing a lot of symptoms. And again, if these symptoms are getting worse, may suggest that something's getting stuck or caught, and again, would benefit from surgery. As with all operations, it's weighing up what's the benefit or the risk of doing something. And if someone has a lot of other medical issues, or if an operation may be a significant risk, then we may consider a more conservative route and keeping an eye on how things are, sometimes using other measures as supports or corsets or trusses occasionally, but they're not so commonly anymore. So it will vary from person to person. And it's worth having that looked at and checked and talked through and seeing what's best for you, really.